Hello, everyone. My name's Rachel. I'm one of the pharmacists here at the University of Montana, and I just wanted to talk to you guys today and see how everybody's doing. I know a lot of you guys are home because we have to do a lot of distance learning right now. So I just wanted to reach out and see if anybody had any questions about pharmacists, and then hopefully I can teach you a little bit about what pharmacists and pharmacies do. So first of all, does anybody know what a pharmacist does? Have you guys ever seen pharmacists? Where do you usually see them? So if you think about a pharmacist, farm, assist, do you think people help or assist on farms? Do pharmacists do that? No. Pharmacists you usually see in pharmacies, and a lot of times you will see them at a community pharmacy in town. If you go into the store and your mom and dad or grandma or grandpa or somebody has to get medicine and you go back and talk to somebody, that's usually where you're going to find the pharmacists. They're also in hospitals. They're also in clinics where you actually might see your doctor. They're in the emergency departments. They're in so many different places. And today I was just going to talk to you a little bit about what pharmacists do and why I became a pharmacist. So when I was little, the first thing that I remember that I wanted to be was a grocery checker. I loved going to the grocery store, and when the grocery checker would scan the items, I loved it. I loved the noise from what I remember. And so, and they were always so friendly to me. And then the second thing that I remember that I wanted to be, a few years later, I decided I wanted to be a marine biologist. And as much fun as that sounded, being able to work with sea life and animals and understand what they did just wasn't something that I actually found myself doing, especially if I wanted to continue to live in Montana. And so as I grew up, I realized that pharmacists actually do a lot of things for people. And the reason I knew that is because my dad is a pharmacist. And once I realized what my dad did and how he helped people, that was something that I decided I wanted to do as well. So I got to spend a lot of time with him, of course, growing up. And I was able to see the different people he helped and how he got to work with doctors and nurses and pharmacy technicians and all these other people inside of the hospital because he worked at a hospital. And that's how I decided that I wanted to go into pharmacy. And here, so many years later, I'm a pharmacist. I've been a pharmacist now for 13 years. So I just wanted to show you a few things that pharmacists can do or have done. So first of all, pharmacists can definitely help people understand their medications and understand how they work in the body. And they also help people realize how they can affect the body as well, which means sometimes when you take a medicine, it'll help you feel good in a couple of days. So especially if you have ever had an ear infection or a sore throat and you've had to take antibiotics, your mom or dad, somebody had to go and get you a prescription from the pharmacy, and then you came home and you had to take it every day for a week or more, and that will help you get better. Medicine can usually help people get better. And sometimes you get maybe an upset stomach from it, or sometimes you get maybe a headache from it. So that's where pharmacists come in, and they can help you understand how medicines are working. And they can also help with many different things. They can take blood pressures for patients. So I have a stethoscope here and a blood pressure cuff. So I can also help people by taking their blood pressure and understand what that means, and if it's too high or if it's too low, ask them some questions and then tell them maybe they need to go see their doctor or their provider. I have an inhaler. So I help people understand how to take this medication and how to use it right. So they're breathing in and holding their breath, and they're understanding why this is working. A lot of times people with asthma have to use this, so I talk to a lot of people with asthma. Pharmacists can also do what's called compounding. So they can take some different medications and some creams, and they can actually grind them together or mix them together. And this is a mortar and pestle. So we can put these together and actually make something that could maybe either go on the skin, so like a lotion to help somebody maybe with some pain, or sometimes they can make dog treats to help a dog or a cat or an animal like a horse, somebody or some animal that might be in need of some medicine too. So it's not always just for humans. So pharmacists can help different animals, different people, young people like your age, older people like maybe your grandparents. They can help people my age. I definitely have had to give my kids medicines. So pharmacists are there to help and to talk with the doctors and the nurses to make sure that the medicines that people are getting are the right amount and the right type. And pharmacists can also help in other ways too. If people have questions, usually pharmacists are available for a lot of people like you to come in and ask questions. So if you have questions about certain medicines, or if you have a rash and you don't know how to treat it, or you don't know if it's serious enough to go into the doctor, a lot of times that's where pharmacists come in too. So they can recommend ways to maybe treat things, how we call it, over the counter. So just on the shelf, you could get something like a cream or an ointment or a tablet or a pill over the counter instead of having to go see your doctor. So I just wanted to explain a few things today. I hope you all enjoyed that. And I know a lot of you are home trying to do a lot of online learning. So good job, everybody. Stick with it. We will get through all of this uncertainty. But I hope you had a good day listening about pharmacists and what they do. And I hope we will talk again soon. Thanks. Have a great day.